Hello, welcome. I am Dr. Eva Bazant, Senior Associate Director of Implementation Research at the Health Campaign Effectiveness Coalition Program at the Task Force for Global Health. On behalf of my colleagues here, I will share the first of three presentations about the implementation research syntheses on campaign integration and campaign transition to primary healthcare systems, and I will provide an introduction. This is an outline of my talk, and I note that the findings of these syntheses are available in two other presentations that you can click on. Before we get too far, I'd like to share a co-created definition. The Health Campaign Coalition's design team in 2020 defined health campaigns as time-bound, intermittent activities addressing specific epidemiological challenges, filling delivery gaps, or providing surge coverage for health interventions in order to target disease outbreaks, eliminate diseases as a public health problem or eradicate them, or achieve other health and related development goals. Terms used for campaigns vary widely by program and may include mass campaign or mass point distribution for bed nets, mass drug administration for medicines administered for neglected tropical diseases, or SIAs, supplemental immunization activities. The HCE Coalition has focused on the health areas of immunizations, including polio, malaria, neglected tropical diseases, and vitamin A supplementation. In a Canberra collective landscaping analysis done in 2019, campaign stakeholders were consulted, and it was found that in addition to campaigns being a key strategy for achieving global health goals, there was significant overlap in the geographies in which campaigns were occurring, often with the same populations and at the same time. There was sometimes little coordination or collaboration among different campaigns. There was a concern about potential inefficiencies and inequities from a proliferation of campaigns that could burden health systems. It was believed that there were opportunities to improve collaboration among campaign stakeholders, to improve campaign quality and align more with primary healthcare systems. So when the HCE Coalition was launched, the vision was for country-led health systems to use a strategic balance of targeted health campaigns in concert with health services offered in the primary healthcare system to achieve and sustain health-related development goals for all people. So what was the rationale for exploring integrated campaigns? The coalition formed a campaign integration working group in 2020, and we began collecting evidence and consulting experts on this topic. What we appreciated was that single intervention campaigns of vertically oriented programs may not address populations' multiple health needs and overlapping health risks. Some communities experience fatigue from campaigns, and this may contribute to the reasons for non-participation across multiple campaigns. It was thought that integrated campaigns may, at times, increase community demand and participation in the campaigns and be an efficient use of resources. So what was the rationale for exploring the transition of campaigns to the primary healthcare system? The Coalition Scientific and Technical Advisory Committee developed a research and learning agenda in 2020, which focused on this topic. And it reflected the shift in external aid that supported the delivery of campaign interventions towards greater government ownership of campaigns. This also reflected the fact that some mass drug administration for NTDs and other campaigns reach a stop or a control phase in which the government continues with maintenance activities and surveillance. This is also true of polio. There was a belief among stakeholders that the transition of campaigns should be properly planned and managed to sustain health gains in the coverage of interventions. Literature reviews identified the benefits and challenges of transitioning health campaigns, and yet more evidence was needed on the process and the impact. So what exactly do we mean by campaign integration? Some more co-created definitions. Campaign integration exists on a continuum. Full integration is the coordination of most or all campaign activities and functions and the provision of two or more health interventions at the point of service, while partial integration involves the collaboration among different entities on specific campaign activities, but without the co-delivery of interventions. An example may be in microplanning or household enumeration. Examples of co-delivery campaigns may be a national immunization day or week, or maternal child health week in some countries, which are often high-profile examples of integrated campaigns that often have media coverage. What do we mean by campaign transition? It is the integration of the delivery of targeted interventions delivered via campaigns into the primary healthcare system and transfer to government ownership. Transition may be full integration into the domestic governance, or may involve strengthening linkages with the primary healthcare system and/or transfer of one or more components of the campaign to the primary healthcare system. The Coalition Scientific and Technical Advisory Committee developed this research and learning agenda with our office in 2020, identifying areas where evidence was needed, including on the process and impact of integration and transition of campaigns. This included questions on the enabling factors and challenges, the approaches used in countries, community engagement levels, the use of digital platforms, and outcomes. This agenda development led to Health Campaign Effectiveness Coalition releasing a request for proposals for implementation research in 2021 through our coalition partners. The receipt and selection of those proposals with expert review and the projects were then funded and implemented by diverse organizations in 2021 and through 2022. In our synthesis, we aim to identify the challenges encountered and the proposed solutions across the projects, summarize the outcomes measured, and identify the promising practices that emerged across the projects in order to inform global stakeholders and country campaign managers and policymakers designing campaign integration and transition policy and activities, and to contribute towards answering those research and learning agenda questions. Overall, the implementation research projects, which were 14 of them, collected a mix of primary and secondary data, both qualitative and quantitative data, sometimes from post-campaign surveys. The program office conducted a qualitative evidence synthesis of the themes in the project reports, as well as collecting information from our interactions with the project teams. We did a descriptive analysis of the outcomes that varied since the projects fell in different health program areas of immunizations, neglected tropical diseases, malaria, and vitamin A supplementation. Also, we were advised in the finalization of the synthesis by a smaller team of expert advisors from the scientific committee, the integration working group, and project teams. I now invite you to click on and hear the other two presentations on the findings of the synthesis of implementation research related to campaign integration and campaign transition. Thank you.